I also had some interest in engineering and mathematics and all those kind of things. And when you think about plastic surgery, you say, why is a plastic surgeon really thinking about? Because there is, sometimes if you think about it, beauty does have proportions, and there is a mathematical code somewhere there. You have to understand vectors, you have to understand proportions. It's a beauty of a combination of working with the human being, and again, working with those proportions, numbers, and things that add up to it. But eventually you like working on beauty. I think all of us want to restore and things, and I think the challenge of being a plastic surgeon is that we can help people look better. We can help them again through their journey of feeling better, because I think it's very important. I think it's part of your appearance represents who you are, and sometimes for genetic reasons, sometimes not everybody is born the way they want to look like. So we have the opportunity of helping, and some people, unfortunately, due to acquired reasons like a gunshot wound or a car accident or a dog bite or a cancer or something, things do change in their life, and we have the capacity and the technology to help them. I think that grew in me as my general surgery training, and it just blended all with all the other things that I did.
Nice,
Yeah.
nice, man. Now, before we started this, you said that the craziest request you ever received from a patient was a little rated R. Can you try to make it PG?
Yeah, I think it was. It's making it PG it's hard. But I had a girl who was involved in a motorcycle accident. She was, for all practical purposes, stellar. She was a model, probably an exotic dancer or
Wow.
something like that. But we're in the middle of rounds, and I'm just walking in a normal hospital, and we were talking about her injuries and whatever, and she's very flexible. So she asked me for some body modification, and very inappropriate way and fashion in the middle of conducting rounds. So that kind of got me off guard, and I was like, wow, how do I walk this? Okay, laughed about it. Yeah, we can help you in a different situation. But that was one of the craziest things that got me off guard. Another patient asked me to make them a tail. That was interesting. Sometimes when we were seeing things, oh, doctor, you can do this and do that, and say, hey, sure, we move tissue, and they say, hey, could you do me a tail? I'm like, you're interested in a tail? Like, what would you do a tail with? But we talked about it, tried about it, but I think eventually I said, I don't think this is one of those things that you really would. How do we deal with putting you a tail in your back and making you happy? A little tail, not
Would it like on the tailbone, like an extension of the tailbone?
No, not to that. It was just like a soft tissue thing, just making like a little dinosaur triangular thing. And I was like, I drew some things joking with her, and I was like, okay, yeah. So thank God that didn't move forward.
Oh, wow.
No.
Now, how do you balance the artistic and technical aspect of plastic surgery?
I think I'll tell you the truth. There is definitely, and again, that's part of one's journey. I think little by little you get like that fine tuning of things. You talk with the greatest plastic surgeons, the older people, and everybody's critiquing themselves. I think you see your pictures, you see what you do, and somewhere or another we're always critiquing ourselves. And then sometimes the artistic part is something that you just let it flow. I think little by little getting the exposure, what's beautiful, what should be appropriate, I think gives you that way of balancing the plastic surgery. And I'll tell you the truth, sometimes when you do trauma and you have to care of all the other people who are really messed up and trying to bring them to a normal, then it kind of teaches you how to try to bring things artistically, because sometimes you're just trying to create, bringing something that's broken into something that is more normal, because it's never 100% normal. Trying to bring that makes you try to really get creative, sometimes in the fastest situations. But I'll tell you the truth, that the artistic part is you always try to, little by little, maybe it's almost like in the kitchen when you add a little bit more. Maybe I should have put a little more stitch here, maybe I should put tension there. Maybe it's almost like I sometimes say it's really almost like you're cooking.
Like cooking,
and you just get little by little better, but you have to critique yourself. And I think that's the way that all of us at some point get kind of balance, and that's how at least I feel that I balance my procedures. Yeah.
Nice. Do you get like whenever you do a job for somebody, do you get a lot of people like being super thankful for what you did and how you were able to reconstruct them back? Like, how's that experience? How's that side of your job? Is it gratifying?
I'll tell you, it's probably one of the coolest things in plastic surgery is that when I was a general surgeon, you would take care of someone's appendix or gallbladder. You follow them till the wound is closed and whatever, and sayonara, you're done. See you. I did a burn fellowship, and now I do burn reconstruction. But when you take care of those patients, are your patients for life. So these are people who are you like, I tell them sometimes I become like the primary care physician, because they come in and see me at least once a year, because everybody's going to come and check their scar, want to see something, or they're going to talk and, hey, do you know someone for this or that? So you almost end up knowing their family. So I end up realizing that they end up referring you, some of the reconstructive patients, especially more like I would say the breast patients, but the cancer patients, because those are patients you continually follow. The burn patients those are patients who are very grateful, because they had a life-changing experience, and from having a life-changing experience, from seeing themselves in a way, and then their life changing, to being in a bad situation, and you being help them to go through that journey of recovery, and then now feeling better about themselves. They're very grateful, and they do invite you into their life and into that journey. And you have people here at Christmas and all the times, and people that I haven't seen in years sometimes, and they are constantly are sending you gifts or little cards or reminders. So it is very gratifying. I think in plastic surgery, I really found that instead, sometimes when we had done general surgery, you finish a patient and you really don't follow them, your patients end up becoming like your patients. These are patients that usually are long-term patients.
Wow, that's excellent, man. Now, what's your favorite procedure like to perform, and why?
I will tell you, I probably will tell you. So there's obviously cosmetic and reconstructive. So I'll tell you, from the reconstructive point of view, I like working around the orbit, around the eye. I like the fact that you can work in a skull, fix it, and sometimes you see an eye that is sunk in and whatever. It's almost like an instant gratification, where you see something that's sunk, you go in. It's almost like people who work in the body shop and you pull out the broken bones and you fix them. So periorbital facial fractures, for me, are probably one of the funnest, coolest cases, and you almost see the anatomy. It's beautiful. Cosmetic, at this stage of my life, I'm enjoying doing breast, because it's a hard procedure. People think that putting a breast implant is easy and working. It is very challenging. There's a relationship between the soft tissue and the breast implant and the bodies and the ribs, and even the patient's posture and body habits, that people don't think about it. Like most people think it's not about just shoving an implant and walking out of there. There is a thought process that goes into that, and just analyzing the skin, the textures, and trying to think about how that relationship between your body and an implant is going to be, and really in the future. I am finding that a real challenge. I think eventually, as I mature in my practice, I think there's other parts of the body that are my interest. I think eventually I would like to work on rhinoplasty and things like that, but I think particularly body lipos, it's where I'm working at as a particular interest as of now. But I think those things do change as you mature as a surgeon.
And you're perfecting it as you go, huh?
Every day you work. I think every day I learn something. Even from the things, people come all happy. My patients will come in happy. Oh, Dr. Castillo, I'm super happy. And I'm thinking to myself, I could have done that a little bit better. Deep inside, I'm like, I should have done. And you're always trying to practice making little adjustments. You look at your pictures, what you could have done better. And now we're an academic. We have residents and people that other doctors were training to be plastic surgeons. So when you're doing that, you are critiquing yourself all the time. And it's one of the good experiences that allow you for personal growth.
Nice, man. Now, what advice do you have for someone considering doing plastic surgery?
I think number one, have realistic expectations. Know what you want. I think that's the first thing you gotta go. Some people will go to a doctor and then they tell you, do whatever you want me to do. I want this, and I want to look like this and look like that. And I think if you're gonna consider plastic surgery, do your research, and it's not going to Real Self or Instagram or whatever. Do your research. There's other sources. Look for education. There's sources about what you might want. And again, the internet is like a big university. If you do the appropriate research, I think you're going to be able to look for those things. But I think see yourself really who you are, and then if you're particularly interested in one part of your body, how you can improve it, and do a little bit of research on that and learn a little bit about that. And then have realistic expectations of things. So I think once you know what you want and have some type of expectation, it's easy to communicate with me or another plastic surgeon, because the idea is that we want to try to deliver something that you want. Sometimes bringing pictures is a good idea. It's very difficult to make someone with a body habit that's completely changed to looking to something else. If you're 6 foot, you can be 5.5 and then want me to look you like a stretch Barbie that's a 7 foot tall girl or a svelte. There's things that we can work on, but there's things that I'm not going to be able to fix. So I think doing a little bit of research, looking at and understanding what procedures you want, and then being able to communicate what you really want to a doctor when you walk into that consultation is the best thing, because you walk in here and don't assume that I know, or that the doctor knows what you want. And if you have a firm idea of what you want and you don't feel that you're able to communicate that with the doctor, maybe come in for a second consultation, or try to make sure that when you walk out of that consultation with a plastic surgeon, that you made sure that your doctor knows what you really want, and make sure that you come with a clear plan. I think, and again, the idea of plastic surgery is a conversation you have to have, a one-on-one with the doctor who's going to operate on you. Don't talk in with a PA or a nurse practitioner at the beginning is a good introduction, but I think eventually, before coming up to a surgical plan, I think you need to talk with the person who's going to really operate on you. You got to feel tissue. You need to know what we're working on. I like to know what the foundation is in order to see if I can. It's almost like building a building and not really knowing what your foundation is to work and doing that procedure. So eventually, you need to talk to your doctor and have that physical exam before you propose a plan.
Oh, okay.
Yeah.
Now, I think we are both in an area where I'm in the digital space, and it's a space that is always moving, it's always progressing, and there's always something new. I believe that you're in the same type of industry. How do you stay up to date with the latest advancements and techniques in plastic surgery?
Yeah, so I was the past president for the Miami Plastic Surgery Society, and I've been involved in different societies, but one of the things is that we have is, in the greater Miami area, all the plastic surgeons in Miami, we meet together once a month, and usually there's a meeting. We bring a speaker from out of town, and there's always that collegiality where we're able to discuss it and talk about different procedures, and that allows that personal growth on a constant basis, on a monthly basis with our local physician. So there's always that communication. Most of us know one another in town, and we have the capacity to meet. Currently, I'm in academics as well, so the fact that I'm in academics now, we're teaching residents, and the fact teaching residents forces me a lot to read, be informed. We have, as you probably see, there's a lot of journals and books like this. We're constantly reading journals and books, but at the same time, we're involved, that we're going to the meetings, and even on our data, we're working on analyzing our data and even trying to propose some of those things to hopefully contribute to the literature in plastic surgery. So the process of teaching is always enriching, and at the same time you're teaching and learning, and it's a good environment. The good thing about, we do have the support of our local societies and as well as the national societies, and I do go to those meetings to constantly, you have to constantly be learning.
Does it seem like never ending?
It never ends. It never ends, and it's fun. It's always like, oh, maybe I should have tried this or should have done something. And there's other doctors and plastic surgeons that are in the community, as well as in my practice. I have other partners, and I can always shoot ideas or talk with other physicians. And it's, again, maintaining that collegiality that we have.
Yeah, it seems like it's a moving target.
Yeah, exactly.
But yeah, I mean, that's great that you keep sharp, man, because that's the way to do it. Now, what do you like to do in your free time when you're not performing surgeries?
At this point, I like working on I'll tell you the truth. I work on a car. I have an old car, so I'm working on one of my cars, restoring one of my cars. But
what kind of car is it, bro?
It's an Toyota FJ40.
Toyota FJ40?
Yeah, it's a Land Cruiser. It's an old Land Cruiser,
okay.
like from the late 70s, early 80s.
Nice.
And I like working on restoring the car. So little by little, there's some things that I can do, and I know that there is a limit to what I can do. So a man knows his limitations, but I've been working on that. I like cooking. I think that's one of those things that I enjoy a lot. And then really, I'm trying
What's your favorite dish to cook?
What is my favorite dish to cook? I will tell you, I think like all men, I think I'm inclined to the grill.
The grill?
I like the grill, yeah.
Nice.
I like the grill. But in the kitchen, and particularly breakfasts for weekends, I like French toast. I'm very picky about my French toast as well.
Nice.
My kids like it. I think with COVID, I gained a little bit of weight, a lot of weight. Actually, I'm making breakfast for them because I had them there and it was good. Yeah, between cooking and the cars and things like that is something. I have another car too as well. I have a Porsche 911, a Turbo S. I wish I had more time to drive it, but yeah, I love cars.
Nice, man.
Yeah, so
nice.
Those are the inclinations that I have. You never grow up that little kid inside of you.
That's right.
Guy, yeah, you know what I mean.
Yeah. No, that's so cool. Nice, man. Now, what's the most rewarding aspect of being a plastic surgeon?
I will tell you, it is again something that is super fun in the sense that I get to work in every part of the body. Like my practice at this point is very diverse. I can be, this week we started with facial fractures. You don't know, you're gonna end up doing tummy tucks, 360s. You're gonna do burn surgery. We do wound care. And I see patients, kid you not, I see little kids to 90-year-old patients. So this week, I think my oldest patient is going to be 94 years old, and my youngest kid, which I'm operating tomorrow, I'm fixing his nose, is I think 5 or 6 years old. Operate through a diverse population. And it's super fun because you get to operate in so many different parts of the body that you have to, it's constantly a challenge, so you can't really get bored of. It keeps me on my feet.
Yeah. Oh, that's good. I mean, it keeps you sharp.
Yeah.
It keeps you super sharp to be able to not just meet up with the doctors that you meet up once a month to study the new surgeries or techniques that are out there, to teach other people. All those things just definitely keep you sharp, right?
Yeah, and learning from other people. Constantly learning, I think that also definitely keeps you sharp. Yeah.
Now, if you could give one piece of advice to your younger self, what would it be?
Oh man, take it easier on myself. I think that's what I would have. Let's say sometimes you're stressed about something, then maybe make decisions or jump into the decisions earlier. Not overthink too many sometimes things. I think it's part of our nature just to overthink and be a little more precautious at things. But I think make more decisions, I think, is definitely one of those things that I say. I think one of the things you have to tell younger kids when you're younger is don't be afraid of making mistakes when you're young. I think that's the thing.
Nice.
Yeah.
All right, doctor, it was great talking to you.
Thank you so much, Gabriel. Thank you for the time, for the interview. Appreciate it.
This was great, and I hope to get in touch with you again.
Awesome. Sounds like a plan.
All right, brother.
All right. Take care. Thank you, man. Bye-bye. Bye.